Good morning, good afternoon, and good evening, everyone. Welcome to today's live class with Scott from Swoosh English. That's my name, in case you don't know. Anyway, welcome to today's live class. First of all, can I just confirm that everyone can, of course, hear me and that everyone can also see me as well, please? My microphone is on. My camera looks to be on as well, but I want to confirm, of course, that everything is okay your end as well. So if you're watching on the Swoosh English Facebook or YouTube, or you're watching on the OET Facebook and YouTube, please just confirm by letting me know in the chat box that you can hear me and that you can see me as well. Joshy John has given me a big thumb up, so I'm going to assume that we're good, at least in this end. Yep, and everyone else is saying that they can hear me and that they can see me as well. Fantastic. Welcome to everyone. Let's see who we have in today's session. I'm going to call out a few names. I'd like to welcome everyone. We have John, Joshy, the mysterious 5 zeros, Chizo, and Christine as well over on one feed. And the other feed, we got a good number of people: Sharaksha, Theza, Jitendra, Edo Someone, Funmilayo. It's always a good tongue twister today. Yasmin, Reshalin, Abu Raya, Raha, Sudha, and Zainab, Anu, and Safal, as well as Era Doherty as well. Welcome to today's session, guys. And over on the Facebook feed, Siddharth, Divine, Jisha, Anu, Ajmi, Kaiser, Sini, Piwai, Sumya, Anitha, Raihana, Nithu, Astaza, MD, Rodi, Marajoy, Vinit, and Flessy, as well as a good number of other people here today as well. Welcome to everyone who's joined today's session. You're very welcome. I hope that you enjoy. So, my name's Scott. I am the academic director at Swoosh English. We're an online premium preparation provider and OET All-Star for the OET exam. We've been doing these live sessions every week now at the same time, 9 a.m. UK time. And we of course do a mixture of reading, listening, and speaking lessons in the current curriculum that we're offering. So if you've been to the classes before, then of course, yeah, you'll know what to expect today. But anyone who is new today, you're very welcome, and I hope that you really enjoy the class. I'm from Ireland. I've been an OET teacher now for a good number of years, and English as a second language teacher for a vast number of years ahead of that. But when I lived in Melbourne, Australia in 2018, I actually worked as an OET interlocutor. So I helped actually administer the reading and listening exams and I conducted the speaking role plays officially in Melbourne, Australia as well. So I'd like to bring that experience to today's session and help you guys out with your OET speaking role plays. So guys, let me know in the comments where you're from and when you're taking the OET exam as well. Give me what you think are your biggest concerns, your biggest issues with the speaking component of the exam. I want to know everything about you today before we get into the class. So let me know where you're from, what time it is, I suppose, as well. It could be very late, it could be very early. When you're taking the OET exam, maybe what your biggest issues are with the exam as well. Thank you. Chizo has said, I am from Nigeria. Thank you very much. We have Shah, Email, Regina, and Deepthi has also joined the session today as well. Thank you. Anyone else, guys? We have Alvin has said from the Philippines, 29th of May in 1 week's time. Alvin, best of luck with your exam. Hope your preparation has been going well. Siddharth is from India, Mohammed from Jordan. We have Sandro from the Philippines. Very nice. Vishnu from Kerala. We have Yasmin living in the UK. Oni from Nigeria. Juan Xavier from Saudi Arabia. Virgil from Romania. Mohammed Salah from Jordan taking the exam on the 12th of June. Very soon to you, Mohammed, as well. Best of luck with your preparation. Sandro, Philippines, 4 p.m. Jasna from Kerala taking the exam on June the 12th. From the UAE. Alvin says thank you. And then Athira from India as well. Great. Thank you very much, guys. Thanks for all that information. A few more people on the other feed. Aline is from Portugal. Very close. Nicole says, I'm Nicole from the Philippines. Please pray for me. My exam will be in June 26th. Wish you the best of luck with your preparation. Hope it goes well for you, Nicole. Dorothy from Zimbabwe, watching in Algeria. Rochelle, July 24th, taking the exam. Banwari from India. And Era is taking the exam on June 12th, living in Ireland. I thought so, because you're taking the surname Doherty. That's very nice, Era. I'm from Ireland as well. And Shivani Sa is from India. Very good. As well as everyone else, thank you very much for giving me all of that information. So, of course, those who are taking the exam next week or the week after, or if at any point, which of course you are, I want to wish you the best of luck with your OET preparation. Hope it's going really well. Okay. Anyway, guys, let's get started into today's session. As you know, we're doing an OET mock speaking exam class, and this is what we're going to cover today. The format's roughly quite similar to what is done every single week, in which we're going to learn and review the scoring criteria for OET speaking. Of course, you're going to learn it if you're new to OET preparation, and we're going to review it in case you have been preparing yourself, because it is so important that you know this criteria, you know what you have to produce in the day of the exam to maximize your chances of getting a B. You're going to take part or listen to OET role plays, and of course, you're going to listen to feedback on student performance from myself, and you're going to give your own as well. I like to hear everyone's opinions on how someone did in the exam. And at the very end, if we have some time, we'll go through a very brief question and answer session where you can ask me any questions about your OET preparation for your speaking or about Swoosh English, etc., etc. We'll do that at the very end if we do have some time. Now, I always start with this question in case anyone's new to OET preparation, but also gets anyone who's been reviewing already to think about their exam prep. What are the two sets of scoring criteria for OET? Throw your comments in, guys. Let me know. While I'm waiting for those comments to come in, I'll just see who else has said hello. We have Joshi is taking the exam on June 12th. Deepthi from India taking the exam 29th of May. Regina, June 26th. Emel from Turkey. Hiba is living in Dublin, taking the exam on June the 12th as well. We have Ung Miao from Myanmar, and we have Chikso said, I've not booked my exam yet, but I plan to book it and write it in July. Make sure you're ready before you do that, Chizo, with my advice to you. Thank you very much. Okay. So we have Siddharth said linguistic and clinical criteria. Okay. Good. That's the first answer we have so far. Any other answers in terms of what the scoring criteria are for OET speaking? Please let me know in the chat box, guys. Jitendra has said clinical and linguistic. Abura said linguistic and communication skills. Reshlin, linguistic and clinical communication as well. Okay, guys, we're roughly on track, which is amazing. These are the two sets of OET criteria, linguistic and clinical communication. So yes, if you're new to the OET exam, you're assessed in two different ways. What do both of these mean? Well, let's break them down now slowly so you can understand a little about what they are in the day of the exam. Okay, I'm just going to enlarge my screen here so everyone can see it nice and clearly. Linguistic criteria is broken down into 4 different sub-criteria. They include your intelligibility, your fluency, your appropriateness of language, and your resources of grammar and expression. But what do these mean and what are you assessed on? Well, intelligibility is your pronunciation, your intonation, and your accent, and how clearly your listener can hear and understand what you are saying. So pronunciation, of course, refers to the various sounds that you produce in the English language, including your vowel sounds, your consonants, your blends, your diphthongs, etc., etc. Intonation is the pitch at which you speak at. Do you rise and fall as is appropriate in the English language? Make sure you don't speak flatly like a robot. You ingest a bit of emotion into your language, right? And then finally, we have accent. A very, very common question I always hear about the OET exam is, what do I do in the OET exam? If I have an accent, do I have to speak with an English accent or an Irish accent, for example, or an American accent? No, you don't. Please don't change your accent. What this means is that if you speak with a particularly thick accent, what you want to do, of course, is reduce that and minimize that in total. Okay, so only reduce your accent if you think it's not too clear to the examiner. I'm doing it right now. Most people do have to minimize when they're speaking, but you don't have to speak with a different accent. Next set is your fluency, the impact of the speed and smoothness of your speech on your listener's understanding. Fluency is not about speaking as fast as you can. Lots of people think, I have to speak really, really quickly. But what happens if you speak quickly? You might get tongue-tied. You might hesitate. You might correct yourself. You might have a false start. My name is Scott, for example. So it's about smoothness, making sure you can speak from beginning to end with few interruptions and few stoppages as possible. So think about the speed you speak at in your own language, your native language, and reduce that slightly. That will help your tongue catch up with your brain when you are speaking. So fluency is about smoothness, not about speed. Has to be suitably fast, but not too fast. Next, we have the appropriateness of language, which is basically your tone and professionalism, aka are you speaking as is suitable to be a doctor or nurse or other professional? You're not speaking too formally, not using too much technical language, but also at the same time not speaking too informally, like you're speaking to your friend in a cafe, for example. So keep that in mind. And then finally, the resources of grammar and expression, which is the impact of your level of grammatical accuracy and vocabulary choices on your listeners' understanding. So grammar, use the grammar that you know, you use it well, make it suitably complicated, not too complicated. And the same with your vocabulary. Use a mixture of technical terms and some complex vocabulary, but don't make it overly technical. And if you are going to use it, then make sure you use it well. That's linguistic criteria. Let's now have a look at the clinical communication criteria, which, as we know, is unique to the OET exam, and it really assesses how effective you are at communicating in a clinical or medical context. So the next set of criteria are as follows. Let's have a look. So they are relationship building, understanding and incorporating, providing structure, information gathering, and information giving. Let's quickly break those down one by one. Relationship building. So, of course, you're having a conversation. It's important for you to make sure that you are building a relationship with your patient, and that involves the impact of your choice of opening to the conversation and demonstration of empathy and respect on your listeners' comfort. So the key takeaway from this is that you need to open suitably to making a conducive conversation. Don't welcome by saying, come in, sit down, what's the problem? Don't say, hi, how are you? Too informal or too serious. Think about a suitably professional opener, which is also simultaneously welcoming and inviting. Hello, my name is Dr. or Nurse so-and-so. I'm going to be attending to you today. How are you doing? Oh, great. Anyway, how can I help you today? What seems to be the problem? It's all about your tone. It's all about the structure of what you're saying as well. So make sure you're opening, you're inviting the patient to speak from the very, very beginning. At the same time, make sure you're demonstrating empathy throughout the conversation. Next, we have, of course, understanding and incorporating, which is the impact of how fully you involve the patient in the conversation on your listener's understanding and comfort. So key from this is that it's a role play, it's a dialogue, it's a two-way conversation. Yes, you as the practitioner, as the expert, will be speaking the majority of the time. Doesn't mean that you should dominate the conversation. You should be inviting the patient to speak as much as they can as well. So think about ways that you can ask questions to get them involved, to create a dialogue involving the patient, but also simultaneously showing that you're listening. That's where some of your listening skills or your active listening will come in. Okay, right, I see. Understand. Gotcha. Phrases like that there when the patient is speaking to show you're listening. And most importantly, when they say something, make sure you respond appropriately and not to something else entirely. Okay. We obviously are maybe thinking about the next part of the role play, but make sure, of course, you're listening at the same time and you're showing that you're responding to the patient's cues, wording, etc., etc. Providing structure. Of course, a role play, the information on the role play should be organized well, and it should provide ways for new topics on discussion and your listeners' understanding. Once again, really emphasizing the need for you to ask questions to create a dialogue and make sure you're logically progressing through the role play. You're also signposting to different parts of the role play. You're indicating what's coming next. So it needs to be nice and cohesive. It needs to be gelled well together as well. Okay, the next two are the last two sub-criteria. Information gathering and information giving are kind of linked. So information gathering talks about the type of questions you ask and how you listen to the responses on your listener's understanding, whereas information giving talks about the impact of how you provide information and check this information is being understood on your listeners' comfort and understanding. So information gathering. Can you ask questions? Can you ask the appropriate questions to get the most out of the patient during the dialogue? Of course, it could be questions about how they're feeling. It could be general questions about parts of the role play, such as what symptoms they're feeling, what's their history, what they've been doing, how they feel about this, etc., etc. So open questions to keep the dialogue going, and then how you respond as well is also appropriate. Whereas information giving is how you, of course, respond to the patient, how you give that information. Is it clear? Is it understandable? But also, can you check for understanding as well? Very, very appropriate for anyone in a clinical communication criteria, clinical communication setting, as well as anyone who wants to be an effective communicator, is to double check that people understand what you are saying. You can ask a series of closed questions to do that. That includes, of course, such as saying phrases such as, how do you feel about this? Is this okay for you? Is this clear to you? Etc., etc. These are important phrases to ask to double emphasize that the patient understands, and the OET information giving criteria will be assessing you on that. Big emphasis on all of that criteria is effective communication. Are you organizing your information well? Are you asking appropriate questions to create a dialogue? Are you checking for understanding? Are you engaging in active listening, etc., etc.? Keep all of that in mind when you do your role play practice. Anyway, that's a brief breakdown. Hopefully you found that useful, or of course you've been using it in your own time, but it is important that you know this role play, you know what the examiner is looking for on the day of the exam. So guys, this is what we're going to do now. I have a set of questions on the screen. It's a series of questions which roughly indicate to you how well you've done in each of the criteria. We have 5 for linguistic criteria, and we have 4 for clinical communication criteria. I'm going to be using these questions today to assess generally how you got on in your role play. The best thing is that you can use these questions too today, or you can take them away and use them in your own OET mock speaking practice that you're doing with your friends, with your provider, with your school, etc., etc. So I'm going to leave these on the screen for a minute or so. Once everyone, of course, has had a chance to look at them, I would like you to either take a picture of the screen or screenshot the screen. When you have done that, please say yes or done in the chat box, please, so that I know you have had a chance to do that, and then we can successfully move on to the next part of the role play today. So have a look at the screen, guys. Please take a picture. Please take a screenshot of this role play, of these role play questions here. When you've done so, please indicate to me in the chat box that you have done that. Once a sufficient number of people have done so, I can move on with the next section. Okay, just wait a few minutes to see a few people come in, and we can check that. Okay, a few people are saying that the screen is blurry. That is nothing that I can control. You need to control that your own end, guys. Make sure you're changing your settings to increase the resolution on your screen. Everything here is transmitted in high definition. So make sure that everything is changed at your end. Rajani, I'm talking to you in particular. So make sure that you're using the highest quality output. Thank you, guys. Thank you very, very much. Fantastic, fantastic. Another few seconds. Great, 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 great. Keep them coming. Okay, another 10 seconds. People to screenshot or take a picture. Perfect, guys. Thank you very much. Okay, so if you missed it this time, we will have a chance to do that again later on to get some more pictures throughout the role play, but well done. All right, now let's move on to the first part of today's speaking session. Now, I'm going to have a chance to get 2 of you in today to do some mock speaking practice with me, 1 for a doctor and 1 for a nurse. So what I'm going to do now very soon is I'm going to show the role play card on the screen, okay? When the role play card appears on the screen, you're all going to plan for this role play as if you're going to do it. The reason why I want everyone to plan is, of course, you might not get a chance to do some speaking, but it's still practicing one essential part of your exam taking skills, and that is your ability to analyze the case notes, organize your information, and conduct it as if you were doing the role play yourself. And of course, then you can follow along with the role play, offer suggestions, offer feedback to the participant who takes part today, which is still very, very important in your analyzing skills and your ability to know the role play and the criteria very, very, very well. Okay, so make sure you have a piece of paper or a pen handy or a notepad. I have my notepad to write down some notes for you guys today, which I'm going to give to the participants who take part in the role play. When the planning does begin, you will see a link in, I'm not sure what way it is, could be bottom, it could be left, could be up, could be right. In your chat box on Facebook or YouTube, you're going to see a link which will invite you to come into the stream with me today. And then I will choose one person to do a role play with me. You have a higher chance of being selected if I can see when you come in that your camera is on, that your microphone is working, because if not, then you might not have a chance to do the role play with me, because we need to make sure that there's no technical issues, so to say. So if you come in, make sure you've got a working microphone, ideally a working webcam, but it's not essential, and a quiet environment and a good internet connection as well. So 2 things: click the link when you're coming in and start preparing for the role play when I put this up on the screen now. Hope that is clear to everyone. So here is role play number 1 today. The first one is for medicine. So for doctors only, I want you to come in to the session today. Okay, so timer on my phone, guys. I'm going to set for 3 minutes, sorry. Once the 3 minutes is up, I'll appear back in the screen and then we can start doing the role play practice. Good luck, everyone. Enjoy preparing for your role play. Okay, everyone, that's 3 minutes up. And thank you, everyone, for taking the time to prepare for the role play. We've had a few people come in and join us in the studio today. Thanks, everyone, for linking and coming into obviously the StreamYard stream with me today. I'm going to have to pick one person now. So I'm going to pick the first person who came in, give them a chance to do some speaking. That is Dr. Rehan. Hello, Dr. Rehan. You are live.
Hello, how are you?
Turn on your microphone, make sure it's working.
Okay, just wait a second. Isn't it working right now? Hello? Doesn't it working right now?
Sorry, Dr. Rehan, I can't hear you. I'm going to try and unmute you again. But I'm afraid I cannot.
Do you hear me now?
Oh, hello, I can hear you now. Fantastic. Perfect. Here we go.
Okay, so how are you?
I'm very well, thanks. How are you doing today?
I'm also fine.
Well, thank you very much for coming in and joining us today. Tell me a bit about yourself and when you're taking your OET exam.
So I'm Dr. Rehan and I'm taking my OET exam on 29th May. If the lockdown shuts off, if the lockdown then remains, then I may not. And I'm working as a doctor in Cox's Bazar.
Awesome. Okay. Well, thanks very much for telling me about that. I hope your OET exam gets to go ahead as well, because no one likes lockdown. That's all I'm going to say about that.
Yeah, so we like it or not, it's necessary.
It is. But of course, when it comes to disrupting people's lifestyles, it is, of course, a bit inconvenient in many ways. But yes, I do agree with you in that. So anyway, my friends, would you be ready to take part in the role play today?
Yeah. Okay, we can start.
Excellent. So I'm going to start the timer now for 5 minutes. You can begin whenever you are ready, and we'll go through the role play.
Okay, so start.
Over to you.
Good afternoon. Okay. Good afternoon. My name is Dr. Rehan. I am the treating doctor today. Before we start, can we check your name, please?
Hi, doctor. My name's Scott.
Okay, Scott. So can you tell me what has brought you in to see me today?
I don't know what's wrong with me, doctor, but I had a really bad bit of flu recently, and I'm feeling very strange. I mean, this morning I couldn't catch my breath, and I thought I was going to die. So I'm still feeling a bit breathless now. So I'm just kind of worried that this might be asthma or something like that. I don't know. You maybe tell me more.
Okay, so you mentioned that you are feeling shortness of breath since today. May I ask you, have you had ever felt this type of symptom before?
No, it's really weird. It's all come on very, very suddenly.
Okay. So you also mentioned that you suspect that you have asthma. Can you please tell me what do you know about asthma?
I know asthma is obviously a condition which affects your airways, and there's some symptoms that kind of appear. Yeah.
Okay. So let me explain that asthma is an inflammation of your airway, and it causes narrowing of airway. It can be caused by many things, such as it can be caused by inherited, like you might have this from your father and relatives, and also you might have some there's some environmental factor that might affect your asthma or like your respiratory problem, such as allergen or dust that can produce this type of syndrome. And as you don't mention that you didn't have any history of asthma, so I think that you you're facing this newly symptom due to maybe allergen. So does it clear?
Yeah. So you're saying that you're saying that you don't think it's sudden, that this would be environmental and genetical.
Yeah.
Okay. I
so
have doctor.
Yeah. Okay, so in your case, I think that it might be environmental factor that along with some family cause that is causing your asthma. So you are asking something. Can you please continue?
Oh, no, please, doctor, keep going.
Okay, so we have already discussed about asthma, And now we will tell you about the treatment option and also the lifestyle modification. Does that sound good?
Yes, please. Sounds interesting.
Okay. So the treatment option includes Ventolin, that is a salbutamol inhaler. We will prescribe you an inhaler that you will take whenever you have asthma. And initially, now you have to take at 2 to 3 puff in twice or thrice daily. By using that, your condition will improve. And also, you need to maintain some lifestyle. You need to avoid dust. You need to avoid there's noise, there's unhealthy environment. Do you think you can do that?
It sounds interesting. Yeah, I understand the environmental factors, but I am a bit concerned about Ventolin. I've heard that it can become very addictive. I don't want to become addicted to any medication. Is this
I
true, Doctor?
appreciate you. Yeah. I appreciate your concern, and it is understandable to feel worried in this situation, as there's a lot of news in the Google about the Ventolin. But let me reassure you that Ventolin is a very safe drug and very safe puff. If you can use whenever you have exacerbation, like now, you will be okay. And in your case, it is necessary. You can't get well without this. And many of my patients are using this inhaler and felt better. So I hope you will feel better also. And there's very, very little chance to get dependence on Ventolin. So is that okay?
Thank you for that information. Makes me feel better about using it. Yeah. I am just quite concerned about my condition. I mean, I thought I was having an asthma attack today, and I thought I was going to die. And I've heard about people dying from asthma attacks. So what's the chance of this happening, doctor? Because I am still quite anxious about this.
Yeah. I appreciate your concern, and that's a good question. That asthma can be serious condition, but if you follow my advice and if you follow the treatment, then I think you will be better very soon, and you also will have a good lifestyle, and your asthma will be controlled. So I don't think that you need to fear a lot from asthma if you follow my advice. But if you don't follow the advice and don't follow the medication, then there might be a risk. So is there anything you want to ask?
I know, doctor. I thank you for the advice today and about the medication. It makes me feel more relaxed already.
Okay, thank you. So I have discussed many things today. Can I briefly summarize?
If you like, doctor, please. Yeah.
Okay, so we have discussed that you have a condition like asthma, and which is caused by environmental factor and also genetic factor. And we also discussed about the treatment modality and lifestyle changes. And we also discussed that if you follow the protocol and the treatment as prescribed, you will be okay and get better soon. So do you think you can do that?
I will, doctor. Thanks so much for your time today. I'll take the Ventolin and I'll check out the environmental factors and I'll try and be calm. Thank you.
Okay, thank you. See you again.
Thank you. Bye.
Bye.
And there we go. Dr. Rehan, well done. How did the role play go for you? How did you feel doing it?
I feel my heart was beating fast, but it's okay. You know, that's in normal patient, we don't feel like heartbeat. But whenever we take in exam, there's everything, the adrenaline rush and everything goes ups and downs.
Oh, so exactly.
It's quite different than talking to a patient, right?
Sure. And that's what we always try and tell our candidates, that imagine you're speaking to a patient and not to an examiner of some sort. So it'll hopefully make you feel more relaxed, which will then just improve everything about your role play. Because yes, nerves can be good, but you have to use them well, and ideally much rather be relaxed in the role play as well. So well done. Thanks a lot for doing that. Let's engage in a bit of self-reflective feedback. First question, Dr. Rehan, what do you think you did well in that role play? What are your strengths?
I think that I just signpost everything, and also I appreciated every. I just empathy. I showed empathy. I missed many points. I can I tried to speak clearly, but I was slowly. In some point, I just stopped and just thinking in any other thing, and also I was not so smooth, in my opinion. And there's I miss many point, like I had to examine you, and I missed that point. It is not good.
Now,
So that's
Dr.
from my
Rehan,
side.
did you notice I asked you what did you do well, and you go straight into, oh, I didn't do this well, I didn't do this. Everyone likes to always talk about themselves critically. That's obviously an important thing to do. But yeah, let's go through a bit of the assessment questions here, and I'll give you some comments in each section, okay? So first of all, did you speak clearly and was easy to understand? Mostly, by the way, you were mostly okay to understand, but there were a few words and phrases. Maybe your intonation was a bit too, or your speed was a bit too rapid. I thought that a few words weren't 100% clear to me when you were speaking, but they were still quite minor. Of course, we're taking part on the internet with a microphone that can change things a bit. Did you vary your pronunciation and intonation relevantly? I thought that you were a very expressive speaker, especially when it came to your intonation. It raised and fall as very appropriate, and your pronunciation, for the most part, was quite good too. Did you speak fluently and smoothly with few hesitations and false starts? For the most part, you're a very comfortable speaker. Of course, there was the occasional ah and or hesitation, not to search for language, but rather thinking, okay, how am I organizing this? What am I going to be saying next? But that's different altogether. I thought overall your fluency was quite good. Did you speak in appropriate language and tone? Very appropriate for a doctor, by the way, suitably clinical, but also nice and relaxed and inviting to have a conversation. And did you use relevant and correct vocabulary and grammatical structures? A few small errors here and there. Of course, I can't really take a note of those while I'm doing the role play itself, but I did take down a few things that you made in terms of mistakes. You said, you don't need to fear a lot. When you're talking about Ventimol, you said you don't need to fear a lot. Would that be correct, or can you correct that for me?
There's nothing to fear.
There's nothing to fear, yes, or you don't need to be afraid, but not fear a lot.
Yes.
Okay, good. And you said it can be inherited. It can be inherited.
That is in genetic. You can have from your family. That yes. I should avoid.
But because you use can plus be, you've used it in the passive, so you need to actually add it can be inherited. Perfect. Yeah, it can be inherited. So a small issue there with that, but once again, quite minor. Didn't really break down my understanding of what you were saying. So well done. Okay, clinical communication criteria. Did you speak in a way that offered empathy and support? Yeah, you were full of it the entire time. You were listening to what I was saying. You were checking that I understood what was being said. I was okay with what was being said. You were engaging in indirect empathy with phrases such as, let me reassure you that, blah, blah, blah. So well done. Did you listen to the patient and respond effectively and appropriately? Yes, for the most part. There were a couple of times where I suppose that when it comes to organizing your speech, where we were kind of thinking, okay, you want to say something? No, I didn't want to say something. Oh, okay. And I maybe disrupted the role play a little bit, but it wasn't really so much about your listening, more about the organization. Was the delivery information structured appropriately? This was probably the one area that I took probably the most critical feedback from. The role play came in at 6 minutes and 41 seconds. So it's a bit long. We need to try and keep that down to about 5 minutes. So you don't have a lot of time to discuss each point. You have to keep moving on and on and on and on throughout. So try and reduce that a bit. So there were a few points maybe that we were discussing about a certain point a bit too long, but we don't have long in that role play. So think about the areas of the role play that are necessary, construct it appropriately, and move from part to part while also engaging in effective information giving and information gathering. And was the patient satisfied with your delivery of information? Yeah, I would. Thanks very much, Dr. Rehan. I came in being fearful of asthma. I came out knowing this drug, I was afraid of it at first. It works. I'm not going to get addicted. There's a few things about my environment, etc. I can change. I need to relax. So well done. I think that you were very, very effective. Last thing to say, of course, about that. is I don't think the summary was really relevant at the very end. That probably added on to your time. So what probably would have been appropriate was, okay, so just to remind you, you're going to be signing up to Ventimore. Here's a prescription from the pharmacy, etc. Try and relax and check out your environment. Nice brief summary about the key points that you have. But I don't think it was necessary to go through everything again. One, for your time management, and two, just for the structure of the role play, if that makes sense to you. Now,
Yeah.
one last thing, even though I think your empathy was really, really good, you used a closed question phrase incorrectly. You said, does it clear?
Is it clear?
Is it
Yeah.
clear?
I have problem with those phrases. I just mix them up. This is the problem in
Yeah.
my
So
case.
is this clear to you? How do you feel about this? But not does it clear? Okay. But there you go. Well done. So Dr. Rehan, few things for you to, of course, to walk away on is just be, of course, use that phrase a bit more appropriately. Think about your time management and think about your structure as well. Would be the most appropriate things. But overall, good role plays. Lots of comments coming in. People are saying Dr. Rehan was awesome at that, and I think you did a really good job altogether. Well, okay.
And thank you for arranging such a mock test. And it was really great input from you. I will try to improvise myself in this situation and hope to see you again.
You're
And if
very
I
welcome.
fail, I will come and follow more of you,
Very welcome,
more
Dr.
videos
Rehan.
of you.
Well, I hope you pass the exam next week, so hopefully you don't have to follow me much longer. But anyway, good luck with your exam, and thanks a lot for coming today. See you later.
See you.
Bye.
Thank you.
Okay, and that was Dr. Rehan. Well done. Everyone throw your comments in. We'll try and read them, but everyone probably thought he did a really good job altogether. But hopefully he picked up on a few things that maybe he could improve on. And of course, reflected upon that in your own role play practice as well today. But well done to him. Okay, guys. So I want to emphasize today how important it is to get feedback in your speaking and your writing, your productive skills for your OET exam. It's really important that you do so to maximize your chances of passing the first time. But I want to, before we move on to the next role play, tell you that, of course, we at Swoosh English are an online English preparation academy for the OET exam. And right now, we're helping you for a little bit less. By less, I mean completely free. If you're interested, you can get signed up to our free OET course today, in which you'll get access to some of our video lessons and quizzes, as well as a free listening and reading mock exam. It's completely free, guys. And if you're thinking about your OET preparation journey, where do I begin? Well, this free course is a fantastic way for you to do so. So if you're interested, you'll see the comments in the chat box. It'll say, give you the links to the free OET courses for doctors and nurses. Get signed up today, guys. Okay, so next role play then today is for a nurse. So same procedure as last time, guys. I'm going to set my timer for 3 minutes. Those 3 minutes will be used for you to prepare for the role play. There's going to be another link coming in, and that link there will, of course, be used for you to come into the StreamYard session with me today and have a chance to do a mock speaking role play. So once again, guys, 3 minutes to plan and prepare, and then we can use that. Okay, guys, 3 minutes starts now. Hi there, everyone. Just noticed there was a small problem with the PowerPoint. I have that fixed, so I'll give everyone a little bit more time now just to read that extra information, and then we'll take part in the role play. So another few seconds, everyone. Okay there, everyone. That's time up for preparation for the role play card. Hope you enjoyed that time doing so. Now, let's take part in the role play today. So I've got a few people who have joined me today. The first person to come in and put on their microphone was Tina. Tina Joseph, I'm going to add you to the stream. Can you hear me? And can you see me, Tina?
Yes, sir.
Hi, Tina. How are you today?
Yeah, I'm fine. Feeling good.
Good to hear. Good to hear. Tell me a bit about yourself.
Actually, I'm a nurse by profession.
Mm-hmm.
Now I am working in Government Medical College, Kochi.
Okay, great to hear. Well, thanks so much for joining me today. So, would you like to start the role play practice with me?
Yes, sir. I'm ready.
Fantastic. So, let you start the role play whenever you have a chance. I think, Tina, your internet might be a little slow. So maybe if you want, you could turn off your camera and just have your voice instead. That might improve the quality of the stream, if that's okay.
Okay, sir.
Okay. Yeah, we want to make sure that it's good to go, okay? If you want to try and turn off your camera and just use your microphone, then we'll try using the role play, okay?
Okay, sir.
Okay, Tina, begin whenever you feel ready.
Yes, sir.
Mhm.
Yes. Good afternoon.
Hi, good afternoon.
My name is Tina Joseph. I am one of the registered nurses working in this hospital casualty ward.
Hi, nurse.
For the
Thanks for saying
documentation purpose, could you please tell me? Okay, for the documentation purpose, could you please tell me your name and age?
Yeah, so I'm here today because, as you know, I've had a road accident as of recently, and I think I need a blood transfusion. I'm really scared about this entire procedure. I'm worried about the possibility of getting infected blood for one, and that really, really worries me.
I'm so sorry to hear from you that. How may I address you?
You may call me Scott.
Oh, okay, Scott. I know you are very much concerned about the procedure, but don't worry. I will explain in detail about this procedure. Are you ready to hear that?
Yes, please.
I think the doctor explained about the need of the blood transfusion. Is that right?
That's right, yes. I'm particularly worried about the fear of getting HIV from a dirty needle and a bad blood transfusion.
Yes, Mr. Scott, your concerns are reasonable, but I need to tell you is that we will provide utmost care to screen the donors before this procedure. So don't bother about this procedure. It will be very safe and it will be done under sterile condition. So there will be no chance to get any infections due to this procedure. How does that sound?
It sounds well. Well, it's good to hear about that, but I'm looking to know about the procedure. I hear there's a number of risks involved about how it doesn't go well, that there is still a chance that we can get infected blood. So can you tell me a bit more about this procedure, please?
Yes, that's a good question, Mr. Scott. Actually, you already told me that you met with an accident and you have lost so much blood. So now we have checked your blood and your hemoglobin level is very low. So you need to undergo one blood transfusion in order to prevent so much complication. it will help you to get a full recovery from your current situation, and you will be all right soon. Is that clear for you?
That is clear, but I'm mostly worried about the chance of getting infected blood because I've heard about it from other people, and I don't want that to happen. I just want to know about what the hospital and the procedure does to make sure that doesn't happen, to make sure I'm safe.
Okay, Mr. Scott, I can understand your concerns. You are very much scared about the about contaminating infections from these types of blood transfusion and all. But I need to tell you is that we will take utmost care to screen the donors before the procedure, and we will test the donated blood for any possible infection. So we will verify the blood for any infection. So if it is all right, then we will do this procedure. Is that clear for you?
Thanks for that. But is this procedure completely necessary, or can I recover without taking it, nurse?
Yes, definitely yes. Actually, if you do this procedure with immediately, then you will recover from your current situation, and you will be get rid of from your current symptoms and all. So I think you got my points.
Okay, but do I need to take the procedure, or can I recover without it? That's what I want to know.
Okay, definitely I will explain in detail about the blood transfusion and the what all of the things that will happen during that procedure. First of all, is that clear for you?
Yes, please.
Okay, first of all, we will provide this procedure in a sterile condition, and we use the new syringes, and during that procedure, our nurses will watch closely. So if anything goes wrong, they will provide utmost care and appropriate management during that procedure. So don't get alarmed about anything about that procedure. Is that clear
Okay,
for you?
so you're saying I need to take the procedure. Okay, that's good to know, nurse.
Yes,
Thank you.
yes, Mr. Scott. And I need to, once again, I need to reassure you that this procedure is very mandatory for your condition. In order to prevent so much complication, you need to undergo this procedure immediately. How does
Okay,
that sound?
okay. It's okay. Yeah, sure. I'll need to think about it a bit more, but I feel more comfortable about it now. So yes, thank you very much for your information, nurse. And what are the next steps?
Okay, Mr. Scott, just wait for a few minutes. I will come back with all the necessary equipments for this blood transfusion and all. And I will provide one leaflet regarding the blood transfusion. It will provide all the information about the procedures and the advantages and all. So if you have any queries regarding that, you can ask me. I will be available at the nursing station. Is that fine with you?
That's fine with me, nurse. Thank you very much for that information. I really appreciate it.
So, Mr. Scott, I wish you a speedy recovery from your symptoms and all. So, once again, I reassure you that if you follow my advice, you will get all right soon. So, thank you for your patient listening.
Thank you very much, nurse. Really appreciate it.
Thank you so much. Have a good day.
All right, and there's the end of the role play. Well done. How did you feel doing it?
I think it's fine.
You think it's fine, Tina? Good. What do you think were your strong points, and what do you think were your weak points that you did in the role play?
I explained almost every points, I think, but some, I think some not that much clarified the patient concern about that contaminated diseases happen.
Okay. So let's go through a few comments, Tina, in terms of how the role play went. Now, first thing I'm going to say is that the connection wasn't 100%, so there may be a time where I was maybe straining to hear a little bit. But when I come into the first question was, did the speaker speak clearly and was easy to understand? I still think that you probably spoke a bit too rapidly. I feel like you didn't really necessarily breathe as you were speaking sometimes. So I want to emphasize the importance of you slowing down a little bit when you're speaking. Think about the speed I'm speaking at, or maybe faster. But it is about communication. Rapid communication can be a little more difficult that way too. So please just bring it down a little bit so that I can hear you better. Okay?
Okay.
However, I did think that you were a fluent speaker. There were a few hesitations and false starts. So your fluency overall was very good. It's just about that being clear and easy to understand. And speed was a big element in that. Did you use appropriate language and tone? Well, for a nurse, you were trying to be informative, but also show empathy at the same time. I think for the most part that it was. And did you use relevant and correct vocabulary and grammatical structures? No big errors I picked up on, maybe a few small things here and there, but that's not really an issue. Okay. So did you speak in a way that offered empathy and support? In terms of the phrases that you used, yes, there was plenty of empathy and support. I'm sorry to hear that you feel that. Let me reassure you, is this okay for you, etc. That was great. But think about the tone in which you say it. Think about how you can express it more in your tone. Oh, I'm really sorry to hear that. I understand why you must think about that. So empathy is also expressed in your tone of voice, not just in the words that you say as well. So how can you make that just seem a bit more genuine while you're speaking? Okay. Did you listen to the patient and respond effectively and appropriately? For the most part, you did. You followed the role play well. We had a great dialogue going on where we were asking each other questions and responding to the questions. A bit more active listening, Tina, might have been good. So whenever I'm speaking, phrases such as, right, okay, okay, no problem. You're listening to what I'm saying. And when I asked the final question to tell me about, do I need the procedure? You talked about the procedure, but didn't really answer the question. And I had to ask it again. And then you answered it eventually. So it's just being effective in terms of your listening skills, hearing what's going on, and can you respond to it effectively. But that was the only one part of the role play. The rest did go pretty well that way, just for your information. And overall, was the patient satisfied with your delivery of information? Well, yeah, of course I was. You reassured me that the procedure was safe, that I needed it. There's a very low chance, pretty much next to no chance of developing a blood infection or HIV. So yeah, I got the information that I needed. Thanks so much for that. Overall, a pretty good role play. Just think about the speed in which you're speaking, Tina.
Okay.
Think about how you can express empathy a bit more in your tone. Think about engaging in some more active listening and making sure you're following the role play well too. How does that sound to you?
Okay.
Okay, happy
Thank
with
you
that?
so much. Yes,
You're very welcome.
Thank you for your valuable comments.
You're very welcome, Tina. Best of luck with your OET exam, and thanks a lot for taking part today. Appreciate it.
Thanks.
See you. Bye. Okay. Well done, Tina, and also well done to our previous doctor today as well. Thank you so much, of course, for taking part in the role play. Throw your comments in, everyone, to see how everyone got on. Share your feedback, share your information to everyone there. We all appreciate that feedback that happens. So well done. 2 role plays down today. I hope everyone found that information useful. And of course, you can use that information to reflect upon your own role play in your own time as well. So our next live class will be another OET listening class. That live class will be a guide to part B. That class will be next Friday, 9 a.m. UK time. Just so you know, we have a live class every week at the same time on the official OET channels on Facebook, on YouTube. So make sure you free up some space in your diaries to come to these official classes every 9 a.m. On Fridays every single week. Okay, and also just a reminder, guys, that if you want to pass your OET exam the first time, do you have the motivation to succeed, the time, the support, the feedback, as well as the tools as well? If you do have all of these, you're on track to passing your exam the first time. Of course, we at Swoosh English want to help you out with that. Just a reminder that we're currently running a free OET course in which you'll get access to some high quality video lessons and quizzes and assessments on the various parts of the OET exam. And you'll also get access to a free listening and reading mock exam with scored feedback as well. If you're interested in attending that free OET course, you will see the sign up there in the box now. It'll say a link for nurses and a link for doctors in your Facebook and YouTube feed. So make sure you get clicking on that now and enjoy our free OET resources here at Swoosh English. So once again, guys, thanks a lot for coming along today. I really appreciate you giving me your time today. Hope that you found the class useful. If you did like it, throw me in a comment, give me a like on Facebook, give me a like on YouTube, so I know that you did appreciate that class. As you can see at the bottom of the screen, if you're looking to contact us in any way here at Swoosh English, then we have our website, www.swooshenglish.com. If you want our support team to help you out with any of your OET queries, we have our inquiries at swooshenglish.com email address as well. So well done, guys. Thanks so much for coming along today. I really appreciate all of your kind comments as well. It makes me appreciate that I'm doing hopefully a good job to help everyone to take part in the role plays today. And I want to wish everyone the best of luck with their OET exam if they're taking it next week or they're taking it the week after with all parts. Hope it all goes great for you. Get signed up to our free OET course. You won't regret it. Lots of free material for you to use in your OET preparation. And I'll see you all next week for our listening part B class. Okay. Chad said, is it free? Yep, completely free. Dolly, if you're looking for some information to join us, then email address at the bottom of the screen and the website address at the bottom of the screen as well. Click on those and follow up on that information. See you everyone. Have a great week. See you next week. Good luck with your studies. Bye-bye.